Hi, this is Dr. Stephen Smith, and today's topic is on lymphedema and mercury. This is something I see in the office occasionally, and when I do, I look at a couple things. First of all, I look at methylation, and I do this by getting a genetic profile. 23andme.com is the least expensive way to look at genetics. That's an ancestry site, but they also have the raw data, which we can then download and run through another website such as LiveWello or Genetic Genie and get the methylation enzymes. Typically, the one that's the biggest problem is MTHFR 677. Now that can be configured as normal, in which case the marker will be green, or heterozygous, meaning you've gotten one normal gene and a SNP from one parent. So, or homozygous, where you've got a bad SNP from both parents. What this does to the enzyme is make it less efficient than a normal one. Produces less output, which is L-methylfolate. Fortunately, you can just take L-methylfolate if you have this problem, and that sort of negates the issue. But these people tend to accumulate toxins. So if there's an injury such as in complex regional pain syndrome, and there's toxin and there's a lymphedema, then they can't clear it. So the lymphedema is persistent. And in the cases I've seen in the office, the culprit usually is tuna fish. So we have them stop eating tuna fish, put them on a chelating agent such as zeolite, and we use ACZ, or PCA, which is a compound that wraps around the mercury. And then we use a homeopathic to stimulate lymphatic flow. And we use a product called Body Anew or Lymphstim, and both these work quite well. And we're usually able to get the swelling down, get the methylation up, and then we chelate out the mercury and the lymphedema goes away. So that's the process. Let me reiterate. Check for methylation, improve lymphatic flow with the homeopathic, and chelate out the heavy metals with either zeolite or another type of chelating agent. And usually you'll reduce the lymphedema, and if you have complex regional pain syndrome, then the pain can start to go down as well. And we've seen this improve very quickly in complex regional pain syndrome. Thank you very much.